No matter what your age, it may be hard to remember everything that happens during your doctor visit. Here are some tips to help you recall important information. Take notes. Check for understanding. Use patient education materials. Talk to other members of the healthcare team. And follow up. Note-taking is important. Bring along a notepad and pencil and write down the main points, or ask the doctor to write them down for you.
These are the changes we talked about making in your medications. I'm going to write them all down. And then it's helpful for me too. Then the patient has a copy of that. I usually make a copy of that. And then the patient often comes back on the next visit. They've got their list from the previous visit that I gave them of what they were supposed to do.
If you can't write while the doctor is talking to you, make notes in the waiting room after the visit.
I always add notes to my list, and before I leave the doctor's office, I take a minute in the waiting room, review the questions and answers in the notes I've taken, and expand as I feel necessary.
Next, check for understanding. During the visit, it's important to make sure you have understood what the doctor says. After all, it's hard to remember something that you didn't fully comprehend.
At the end of the visit, you should make sure to say back to that doctor, it is my understanding that I am to do X, Y, and Z, and make sure that the doctor agrees that that's what had occurred during that visit.
Restating things probably is one of the most helpful ways for the patient to say, okay, let me make sure I've understood this correctly. What you've just told me is that I should do this, and this, in the morning, but I shouldn't do this until the afternoon, and I should only be doing this 3 days a week.
Use patient education materials. Ask if your doctor has any brochures, DVDs, CDs, or can refer you to any websites that provide information about your health conditions or treatments.
That often it's very helpful to give a patient a pamphlet or a booklet. It's another place where the internet can be helpful and say, okay, here's a very helpful website that when you have some time and you're feeling rested, you can sit down and look at this and read through some of this stuff.
Consider speaking with other members of the healthcare team. Sometimes the doctor may want you to talk with other health professionals, such as nurses, physician assistants, pharmacists, and occupational or physical therapists who may be able to take more time with you than the doctor. Finally, feel free to follow up. If you are uncertain about the doctor's instructions after you get home, call the office.
If you forgot to ask an important question during your doctor's visit, and you realize that after you've left, I would recommend that you call the doctor's office and leave a message as to what your question is. Oftentimes it'll go to the nurse will respond to you. Sometimes it's effective to simply write a note and send that to the doctor's office, but it's important for you to get the information that you need, and you should follow up.
And if you need to leave a message, make sure to provide detailed information.
If it's a prescription question, that they provide the phone number of their pharmacy that they need a prescription called to. And, in the modern era, leave more than one phone number for them to be called back at. If they're going to be in and out during the course of the day, leave a cell phone number as well as a home phone number so that the doctor isn't playing phone tap trying to catch up with them.